Test, glucose tolerance, the blood test done to make the diagnosis of diabetes mellitus. The test may also be done for other purposes such as to diagnose hypoglycemia, low blood sugar, or a malabsorption syndrome in which sugar is not absorbed properly through the intestines into the bloodstream. The test was designed originally to determine the tolerance for the sugar glucose. Tolerance refers to the body's ability to tolerate glucose. However, the test is not that simple. The test depends on a number of factors including the ability of the intestine to absorb glucose, the power of the liver to take up and store glucose, the capacity of the pancreas to produce insulin, the amount of active insulin it produces, and the sensitivity of the cells in the body to the action of insulin. For the test, you fast overnight and then are given a specific amount 50, 75, or 100 grams of glucose by mouth, and then your blood glucose levels are monitored for 3 hours. Normally, the blood glucose should return to normal within 2 to 2.5 hours. The outcome of the test may indicate normal glucose tolerance, abnormal glucose tolerance, depressed glucose tolerance, in which the blood glucose peaks sharply before declining slower than usual to normal levels, as in diabetes mellitus, hemochromatosis, iron overload disease, Cushing syndrome, too much cortisol, cortisone hormone, pheochromocytoma, adrenal in producing tumor, central nervous system lesions, increased glucose tolerance, in which the blood glucose levels peak at lower than normal levels, as in the malabsorption syndrome, insulinoma, an insulin-producing tumor, Addison disease, adrenocortical insufficiency, hypopituitarism, underactivity of the pituitary gland, hypothyroidism, underactivity of the thyroid gland. Since the dose of glucose is taken by mouth, the test is sometimes called an oral glucose tolerance test.